What are the emergency signs of a diverticulitis abscess? Imagine feeling a sudden sharp pain in your lower left belly that just keeps getting worse. That could be a sign of something serious happening inside your abdomen. When it comes to diverticulitis, which is when small pouches in your colon become inflamed or infected, sometimes the infection can turn into an abscess. An abscess is a pocket of pus that forms outside the colon wall, and it needs urgent medical attention. Recognizing the warning signs early can make a big difference in preventing life-threatening complications like infection spreading into your abdominal cavity or your bloodstream. One of the clearest signs of an abscess is severe, worsening pain in the lower left abdomen. The pain might start off mild but then suddenly become intense, persistent, or spread to other parts of your belly. If the pain suddenly becomes much worse or you notice a sudden increase in discomfort, it could mean a perforation, which is a hole in the colon, or that an abscess has formed and is enlarging. Along with pain, a high fever accompanied by chills or sweating is a red flag. These symptoms suggest a significant infection that might have spread beyond the colon and needs immediate attention. Tenderness when you touch your belly is another warning sign. Your abdomen might feel very sore or even swollen, and you might notice a firm mass if the abscess is large enough. Bloating and distension can also occur. Persistent nausea and vomiting are common when the infection worsens or if there is an obstruction in your bowel. If you find yourself unable to keep fluids down or if vomiting is severe, it's a sign that you need urgent care. Changes in bowel habits, such as severe constipation, inability to pass gas or stool, or even bloody diarrhea, can also point to complications like an abscess or bowel obstruction. Systemic signs of infection are very serious. Rapid heartbeat, low blood pressure, confusion, or feeling extremely unwell are all signs that the infection might be spreading throughout your body. These symptoms requiring immediate emergency care. Sometimes, rectal bleeding can happen if the abscess causes damage or irritation, and this also warrants urgent evaluation. If you or someone else with diverticulitis develops any of these signs, especially severe pain that gets worse, high fever, chills, vomiting, or signs of systemic illness, do not wait. Seek emergency medical help right away. These symptoms suggest that an abscess may have formed or that the infection has become more serious. Delaying treatment can lead to dangerous complications like peritonitis, which is infection of the abdominal lining, or sepsis, a life-threatening body-wide response to infection. Remember, managing diverticulitis requires close monitoring. Mild symptoms might be treated with rest, fluids, and antibiotics prescribed by your doctor. But if you notice any of these emergency signs, it's crucial to get evaluated immediately. Do not try to handle these symptoms at home. Prompt medical care can save lives and prevent serious health issues. Always consult your healthcare provider for personalized advice, and keep in mind that symptoms and risks can vary from person to person. This information aligns with current medical guidelines and expert consensus on diverticulitis and its potential complications.